Hello everyone, I'm Urologist Ömür Erdem Akkaya. The topic we will talk about today will be on whether penis lengthening can be achieved without surgery. What has been done with penis vacuum pump devices or penile traction devices? Have successful results been achieved? We will have a short video about this. Our study is as follows. In 2010, the patient is undergoing a penile prosthesis operation. Penile prosthesis is applied to a patient with erectile dysfunction, and one of the most important problems after penile prosthesis surgery is shortening of the penis length. There may be a shortening of the penis length around 1 or 2 centimeters. An already short penis of the patient will become even shorter, and the patient may have problems with sexual intercourse after surgery, which is what happened in the patient in this study. After the surgery, the patient started having difficulty having intercourse and contacted the doctor who performed the surgery. Unfortunately, the doctor who operated on him and 3 other doctors he visited told the patient that they could not do anything about it. The patient then goes to another clinic. He is evaluated in that clinic. In the meantime, the patient also had a condition associated with a decrease in libido and loss of energy that had been going on for 3 or 4 years, which is also important. When the patient went to this clinic, it was determined that the stretched length of the penis was around 10 centimeters and the loose state was around 8.1. The treatment plan for the patient is as follows. The patient first used only the penis vacuum pump device for 4 months, 10 minutes twice a day, for a total of 20 minutes. But the result after 4 months was not very encouraging. After 4 months, only half a centimeter of growth was detected. The patient is then re-evaluated. Testosterone replacement therapy is started because the patient has low testosterone. At the same time, a penile traction device is additionally given to the patient along with the penis vacuum pump device. And the patient is treated with a penile traction device with a vacuum pump 8 hours a day, taking a 20-minute break in 2-hour periods. After 12 months, the approximate lengthening of the penis is determined to be 2.3 centimeters. Now, is this 2.3 centimeters important? I think it does. Why is that? Because it provided the opportunity to replace the patient's 15 centimeter penis prosthesis with an 18 centimeter penis prosthesis. How is the patient doing in follow-up? It was found that with a longer penis, the patient was able to have intercourse with his partner much more easily, and that his partner's satisfaction and sexual satisfaction increased. When we look at other studies on this, there is a study conducted on 21 male patients with dysmorphophobia for about 12 months. In this study, almost similar results were obtained. There was a growth of 1.3 centimeters in the down state and 2.1 centimeters in the erect state. Interestingly, in this publication, the highest lengthening was found in a patient who had previously undergone penile lengthening surgery, but instead of penis lengthening, it shortened. The summary of this study is that when penis traction devices are combined with penis pump devices, the penile traction device is very likely to lengthen the penis. But as in this publication, the patient must be very determined and patient and persistent. I don't think anyone would have the patience to use a penis device for 8 hours a day, frankly. To be honest, I have seen 1 or 2 patients who told me that they used a penile traction device and had an increase in penis length. It's a difficult situation. And the patient has to be very careful. He shouldn't be too rough. He has to be able to do it without damaging the penis. But for example, this patient is around 50-60 years old and he did it successfully without damaging his penis and managed to increase his sexual intercourse and satisfaction level. This treatment is also enhanced with testosterone replacement therapy. This treatment can also be supported by stem cell therapy to regenerate penile tissues, PRP therapy, or penile multi-wave therapy, as well as treatments to increase penile blood supply, which is what we do here. As I said, in general, if the patient is patient, it can provide an extension of 2.3 centimeters to 2.5 centimeters in the patient's penis length. This is already almost equivalent to the results obtained with penis lengthening surgeries. Thank you for listening, best regards.